ARUSC, a system to optimize antibiotic use. How do we use ARUSC to treat concurrent infections? An inpatient developed nosocomial fever, diarrhea and was otherwise stable. A central line infection was also suspected, although the exit site looks clean. IV piperacillin tazobactam was ordered. ARUSC was auto-triggered. Why did ARUSC suggest vancomycin and amikacin? Guidelines recommend therapy be based on severity, risk factors for infection and likely pathogens. In mild to moderately ill, it is recommended that antibiotics be considered. If seriously ill, antibiotics must be initiated. In a recent published review, the most common organisms in Southeast Asia are Acinetobacter, Klebsiella and Staph aureus. Vancomycin and amikacin provides adequate coverage for these organisms. ARUSC differentiates severity using factors of the pit bacteremia score. If severe, ARUSC suggests vancomycin, meropenem amikacin. Carbapenems are first line for ESBLs. MRSA, carbapenem-resistant Acinetobacter can be covered by vancomycin and amikacin. A definitive diagnosis of catheter-related bloodstream infection requires positive percutaneous blood culture results with concordant microbial growth from the catheter tip or catheter-drawn cultures. Concurrently, ARUSC was queried for antibiotic recommendations for Clostridium difficile diarrhea. It is important to check and keep vancomycin and amikacin for the suspected line infection. On day 3 of therapy, patient remains febrile. Blood cultures were all negative. Can ARUSC help? Blood cultures negative suggest that central line infection is unlikely. This is also supported by guidelines. Vancomycin and amikacin was discontinued. Clostridium difficile toxin was positive and metronidazole was continued for 10 days. ARUSC is able to provide recommendations for multiple infections. ARUSC provides antibiotic overlap check and alerts the prescriber. However, the prescriber will need to rationalize the antibiotic spectrums. Consult your pharmacists when in doubt.
Thank you for watching. Please go to the Google form to answer some questions and stand to win attractive prizes. Antibiotics save it from extinction.
Created using Powtoon.